context up to what is going to follow. Basically, this is mainly for our friends in the press, and some of our friends are here at Mayo, just to try to explain to you the complexity of what we are dealing with in this country when it comes to a fundamental right. So, while the government is spending a lot of time, money and effort behind infrastructure, our firm belief is that education and healthcare is as core infrastructure as anything else. However, we don't seem to be paying the same amount of emphasis and not putting the same amount of money to make this relevant. There is a lot said, written, spoken about India, the promise of the demographics, the richness of the population, the fact that we are going to reach this great population dividend because of the size of who we are. We keep talking about, and the Prime Minister keeps talking about the fact that we want to be a 2025. We do know, especially those of us who live here, work here, believe fundamentally in this promise. We do believe that we are going to go higher. We genuinely believe that there is a lot of enthusiasm and excitement in spite of all the dark, gloomy clouds that we see across the globe. There are many things which are macro that we won't be able to control. But what we can control is our own destiny of ensuring that we continue to do the right things to make the economy grow. I think when we look at Indian healthcare, the fundamentals are extremely strong. 1.3 billion people, unfortunately, we are never going to run short of patients. But at the end of the day, the amount of money that exists on the ground and for what we need to do, it's still woefully inadequate. We are seeing a great growth when it comes to insurance penetration, the government launching what is called the Modi Care scheme, ensuring that people can get more and more affordable care. We are seeing favorable demand patterns, and more importantly, especially across the neighboring countries, we are seeing a lot of growth of medical tourism. However, the challenges, and that's what I want to highlight, and that's why I believe this partnership could be a game changer, lies in the following few statistics. First, as a doctor, let me tell you that when I was training 25 years ago, the main issue that we were facing when it came to our patients was infectious diseases. The good part about infectious diseases is that you treat patients with antibiotics, they get better, and they go back to their normal productive life. Today, we are at the cusp of what we call chronic lifestyle diseases. Things like hypertension, diabetes, pollution-related lung diseases, different forms of cancer. And why is that important? Because if I am a hypertensive, then I become a hypertensive for life. This is not going away. This needs to be managed, which means now I need an entire ecosystem of doctors, drugs, diagnostic testing, hospitals. Now think about it for a second. I just told you why I was excited about having 1.3 billion people. Now just start thinking about the number of patients that we are creating on an annual basis in this country. The second sobering thought is that only 70% of infrastructure belongs with the public sector, while the public sector only takes care of 30% of the population, which means that the private sector has to find innovative ways of partnering with the government to take care of this challenge. From any metric, and I'm using WHO standards, so whether it comes to beds, number of doctors per 1,000 population, number of nurses, we are woefully short, and it varies from state to state. I must say that in Telangana and Andhra Pradesh, we seem to be a higher parameter from a lot of other states in India. Having said that, there's a lot of work that needs to be done. And the last point I want to highlight, especially for our friends in the press, that we only spend 1.3% GDP on healthcare, which is pretty much non-existent. Compared to maybe 15% in the United States, I'm not pretending that's the right number that we should go aspire to. But having said that, that's the gap that we are seeing on what should be spent on the ground and what we need to do. To us, as we look forward, we do believe that there are four parameters that we have to assess whatever we do in healthcare. It's about improving awareness. We have to penetrate and lead to more accessibility, especially in the rural areas and the tier 2 and tier 3 cities. We have to make healthcare affordable, because as you know, probably healthcare costs is the biggest single cause of death in this country today. And the last, which a lot of people don't talk about, which I think is a fundamental to the two institutions represented here on the dais, is quality. Just because our patients cannot afford to pay does not mean that they deserve shoddy quality. So without further ado, I do want to make this plea that this partnership or collaboration that we will unveil right now will look at these four metrics, but we should never lose sight of what we want to do when it comes to quality for our patients, doctors, nurses, and all stakeholders. Thank you very much.